Good day everyone! My name is Erich Catig, a Caregiving NCII Student of St. Augustine School of Nursing, Quezon City. For today's video, we will be performing oral care. Mouth care is defined as the scientific care of the teeth and mouth. The purposes of this procedure are the following. This is to keep the mucosa clean, soft, moist and intact, to keep the lips clean and also soft and intact, to prevent oral infections, to remove food debris as well as dental plaque without damaging the gum, to alleviate pain, discomfort, and enhance oral intake and appetite, and to prevent halitosis or relieve it and freshen the mouth. These are the materials that we needed. We needed the tray, the gauze padded tongue depressor, torch, appropriate equipment for cleaning like toothbrush, foam swabs, gauze padded tongue depressor, cotton ball with artery forceps and dissecting forceps or oral care agents, and toothpaste or antiseptic solution. Also consider nursing assessment, hospital policy, and doctor's prescriptions if there's any when you select oral agent. In addition, we also have the cotton ball, kidney tray, Macintosh, middle towel, jug with tap water, paper bags, and lubricants just to soften the lips. And of course, suction catheter with suction apparatus if available, and also the disposable gloves. So providing oral care for independent client. We do have two types of oral care today. So we'll be doing the independent care, the providing oral care for independent client, and providing oral care for dependent clients. So we have to explain the procedure to our client. This is to foster information, cooperation, and understanding in participation in doing the oral care. We also have collected all the necessary instruments here beside me so that we could organize or facilitate accurate skill performance. And also, we have to close the door or put screen to maintain privacy and perform hand hygiene. This is to prevent the spread of infection. And if you will use solutions such as sodium bicarbonate, prepare the solutions required prior to the procedure each time before to maximize their efficacy. So let's proceed to the actual procedure. Good day, sir. My name is Erich and I'm your caregiver assigned today. We'll be doing oral care. We'll be cleaning your mouth. Are you good with that? Okay, your name again. And how old are you? Okay, 15. Thank you. So we have to assess the client in a comfortable upright sitting position. This is to promote comfort and safety and effectiveness of the care, including the oral infection and assessment. To inspect the whole oral cavity such as teeth, gums, mucosa, and tongue with the aid of gauze padded tongue depressor and torch. This is the process of the comprehensive assessment in order to be essential to determine individual needs. So I'll be using this. If you don't have a gauze padded tongue depressor, you can use popsicle stick. Alright, so now I'll be checking the inside part of the mouth if there are oral cavities. So I'll be using this torch. Sir, can you open your mouth? We have also to take notes if you find any abnormalities like bleeding, swelling, ulcers, and sores, and etc. Some clients with anemia, immunosuppression, diabetes, renal impairment, epilepsy, and taking steroids should be paid attention to oral condition. They may have complications in oral cavities. Place face towel over the client's chest or on the thigh with Macintosh. This is to prevent the clothing from wetting and not to give uncomfortable conditions. So sir, I've been putting this Macintosh. Okay. Then, put the kidney tray or small basin in hand or assist the client holding the kidney tray. So here, can you hold this one? And then the effective in dislodging debris, this is to receive disposal surely, so that it will be easy for him to spit the water that will be draining from his mouth. So instruct also the client to brush the teeth. Effective dislodging debris and dental plaque from teeth and gingival margin. So, I'm gonna give you another brush, sir, with this. If the client is able to brush, let him do it, but with supervision. But if not, you can use a swab and put some toothpaste or cleaning ingredient on this one. But since our client is able, he can continue brushing his teeth from mouth, from outside, then up and down. And we already rinsed the oral cavity to make comfort and not to remain any fluid from debris and to reduce potential for infection. So we have also to confirm the condition of the client's teeth, gums, and tongue and apply lubricant to lips. This is to moisturize lips and reduce risk from cracking. So we have to ask, so sir, are you okay? How are you feeling? Feeling clean inside? So feeling good right now. And then I'm gonna check again, sir, if there are debris on your gums and teeth. I think you did well. And then we can also use dental floss if needed, but this time I'm gonna ask the client to put some on the lips to moisturize it to prevent cracking. Okay, sir, can you use your hand? Very good. Alright. So to rinse all the materials here. and we have to replace all the instruments to prepare equipments for the next procedure. So we have to also discard dirt properly and safety to maintain standard precautions. And right after we did the cleaning or the oral care, we have also to sanitize our hands or remove the gloves and wash our hands to prevent from spread of infection. And right after that, we have to document the care and sign the records, document the care and sign of the records and the chart with your signature. Report any abnormalities to the senior staff. Documentation provides coordination of care, and giving signature maintains professional accountability. So I'll be putting back my client to his comfortable position right now. Put you back in your comfortable position. Slide. And that's it, guys. Second part of this video is we'll be doing the oral care for dependent client. So first and foremost, you have to check client's identification and condition. So what we're going to do is to check his hand on the identification if there's any, like the label, the name, the age, if it is correct based on the order that you received from the doctor or senior staff. Then since it is correct now, this is providing nursing care for the correct client with appropriate way. Then we'll be explaining the purpose and procedure to the client, like providing information, fosters cooperation and understanding. So sir, I know your name is ANDREI, and we'll be doing the oral care. Since you cannot do it by your own, I'll be doing that for you. Okay? We'll be doing the oral care. Alright? So we'll also close the door and put the screen to maintain privacy. Then we'll be performing hand hygiene and wear disposable gloves to prevent the spread of infection. So we already collected the required equipment over here and bring the articles to the bedside. If you will use solutions such as sodium bicarbonate, you have to prepare it prior to the procedure. This is to maximize their efficacy. Then keep the client in a side lying or in a comfortable position. So I will be putting you in a side lying. Sideline position, and then I'll be placing the Macintosh and towel on the neck to the chest. This is to avoid from wetting the bed or the clothing of the client. And then I'll be putting the kidney tray or the small basin over the towel of Macintosh under the chin. And it will be facilitating the drainage from the client's mouth. Then I'll be inspecting the oral cavity using this gauze padded depressor and our torch. Inspecting the oral cavity right now. This is the comprehensive assessment. Is essential to determine individual needs. Some clients may have anemia, immunosuppression, diabetes or renal impairment, epilepsy, and taking steroids should be paid attention to oral condition. They may have complications in oral cavity. So you have to explain to your client, sir, can you please open your mouth? Checking if there are cavities, your gums. And we'll be cleaning the oral surfaces. So we'll be doing this one. I already did the checking, and then we're now doing the cleaning. So we have to start from cleaning the client's teeth from incisors to molars. Okay, so we'll be cleaning the teeth from the incisors to molars using up and down movements from gums to crown. If the client cannot really open the mouth, you can use a help of the gauze padded to make it easier for you. You can also clean the from proximal to distal. Also use suctioning tube just to prevent the water from soaking or the water from leaking over this bed. Then clean the area. Then after that, you can also you have to check if there is any cavities remaining. So open your mouth, sir. And then, since we already did the cleaning and the client is okay now, so we have to check also using this cotton balls to swab and to dry up the inside part if needed. And then remove now the towel and the Macintosh. Back to the client's property area. You can also use the dental floss if needed. Okay, so since we are already cleaned the client, we already cleaned the tongue from the inner to outer aspect. And then, are you good now, sir? Are you feeling? Okay, so you're feeling fresh right now. Okay, then I'll be putting the client to a comfortable position now. Okay, so if there's anything that you need, just tell us. Alright, so you just advise us if you need something from, if you need anything that you needed right away. Right, sir? So we already rinsed the oral cavity and we already confirmed the condition of the client's teeth, gums, and tongue. And now we'll be applying a lubricant to the lips to avoid chapping or cracking. Sir, petroleum jelly, sir. Alright. So, you feeling good, sir? Yes. Alright. Then we already rinsed and dried the toothbrushes thoroughly and returned to the proper place or for the personal belongings of our client after drying. Now we already replaced the instruments to prepare equipment for the next procedure. Now we will discard the dirt properly and safely, like this one. What's inside of that will be throwing in to maintain the standard precautions, and we'll remove the gloves and wash our hands to prevent the spread of infection. Right after that, we will document the care and sign of the records and the chart with your signature and report any abnormalities to senior staff. So this time, since there is no abnormalities, but still we'll be recording everything that we did. The documentation provides coordination of care, and giving signature maintains professional accountability. Alright, so that's it, guys. These are the procedures in performing oral care for dependent an independent client. Hope you've learned something from this video. Thank you so much for watching and have a great day. Bye guys!